Are you ready to be at the forefront of family building and reproductive health? Join us for ASRM 2024 in Denver, Colorado, October 19th through the 23rd. This year's event features expanded meeting spaces, more seating, and a new global health track as part of a comprehensive program that goes beyond infertility to cover all aspects of reproductive health. We welcome members, trainees, and colleagues from every corner of the globe. Join us for an unforgettable experience at the ASRM 2024 Scientific Congress and Expo. For more information and to register, visit asrmcongress.org. Part of ASRM's mission in 2024 and beyond is to explore equity, access, and innovation. What does that mean? This season, we are going to break down equity, access, and innovation to gain a deeper understanding of what they mean to reproductive medicine. I am Jeffrey Hayes, and this is ASRM Today.
Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
Episode 1. What is equity? I think this question leans towards another question of what I can essentially call fairness. That is, what is fair and what is not fair? But in the field of reproductive medicine, how can a concept like fairness be applied? I thought a good place to start would be getting some perspective from within the ASRM organization. Paula Amato, president of ASRM.
Yeah, I like to think of, DEI or diversity, equity, and inclusion all together. And I think as far as ASRM goes, I think we approach this topic in a couple of different ways. One, we want the organization itself to be diverse, equitable, and inclusive. Different kinds of people, and that's both in the membership and at the leadership level. And then I think about patients and health disparities and how, different groups of patients have different levels of access to reproductive health care in general, and trying to make that more equitable by reducing health disparities and increasing access and improving outcomes for everybody.
Dr. Amato presented compelling points, especially about being diverse and a question of patient access. It helped me to get some grounding as I went off and did some deeper digging into crafting a better idea of equity in reproductive medicine. Dr. Jen Kawas, Professor, Division Director, Reproductive Endocrinology and Infertility at Emory University.
And so as a physician, it is our role and responsibility to help patients make educated decisions about which of these interventions will actually help them, which of them may or may not help them, and which of them have the potential to harm them. And it is one of the areas in which sort of the expertise of having had medical training in terms of being able to analyze existing evidence, the ability to sort of qualify the rigor with which the study was performed and whether or not the results of that study are in fact generalizable or relatable to the patient, that particular patient, is something that would be difficult for that patient in and of themselves or alone without the guidance of a physician that's really truly trying to weigh the evidence to do that on their own. So it's in many ways the physician's role to protect the patient because they are in a vulnerable place. And so we are not only trying to help them, but also make sure that the decisions they make are founded in science, or that if it's something that is in fact innovative, that they are fully aware of the risks and benefits of that intervention.
Let me take a few minutes to tell you a story. Once upon a time, in a bustling city called Metroville, there was a renowned medical institution called Metroville Medical Center. This center was known for its cutting-edge reproductive medicine, offering hope to countless couples and individuals longing to start a family. However, beneath the surface of success and innovation, there lay an issue that was gradually coming to light. There was inequity in the reproductive health care being provided. Dr. Maya Johnson, a dedicated reproductive endocrinologist, had spent over a decade at Metroville Medical Center. She was passionate about helping people achieve their dreams of parenthood. She had always believed that everyone deserved a fair chance. However, she couldn't ignore the disparities she noticed. Many of her patients were affluent, able to afford the expensive treatments and medications, while lower-income individuals and those from marginalized communities often struggled to access even the most basic of care. Dr. Johnson launched the Equity in Reproductive Medicine Initiative. Their mission was to make reproductive health care accessible and affordable for all, regardless of socioeconomic status. They started by conducting a comprehensive study to understand the extent of the disparities. The data they collected was eye-opening. Armed with this data, they began to take action. They advocated for policy changes at both the state and local levels, pushing for insurance coverage of fertility treatments and greater funding for public health clinics. They also established partnerships with local community organizations to provide education and outreach, ensuring that information about reproductive health and available services reached underserved populations. The initiative also focused on training healthcare providers to recognize and address implicit biases, ensuring that all patients received compassionate and equitable care. They held workshops and seminars, bringing in experts to educate the staff about cultural competence and the importance of understanding diverse perspectives on reproductive health. Now, I have to confess to you, I used ChatGPT to write the preceding narrative with the intention of giving me something to anchor my discussion to, what I've been able to summarize from my findings, and this is by no means a definitive definition about equity is. Equity in reproductive medicine means creating a healthcare environment where every individual has the opportunity to achieve optimal reproductive health. This involves ensuring cultural competency, advocating for supportive policies, conducting inclusive research, and providing comprehensive education and support services. By addressing these factors, reproductive medicine can become more equitable, improving outcomes for all individuals. So, if we're able to address equity in reproductive medicine in this way, what about access? And what is the relationship exactly between equity and access? Tune into our next episode, where we will dive deeper into the question of access and what that means in reproductive medicine, here on ASRM Today.
This concludes this episode of ASRM Today. For show notes, author information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM. ASRM Today series podcasts are supported in part by the ASRM Corporate Member Council.
The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These are provided as a source of general information and are not a substitute for consultation with a physician.